Good morning, good afternoon, good evening, everyone. Welcome to the second season of the Public Health Gems podcast. We are so excited to be back for a second season with some wonderful subject expert matters in the field. We'll be going into all different topics, weaving in and out of public health and health in general, and just looking forward to a great season. So, today we have a great conversation for you all. Before we get started, just a little bit of background. If you are a first-time listener or a first-time joining us, the Public Health Gems podcast is by the Public Health John. That's me. I'm Christine Ivory, your host of the podcast here. During our podcast, we're going to get into conversations, as I mentioned, around health and public health, and really just dive into the social determinants of health as we know, where we work, where we live, and we play, and the external factors that affect our life and our families. And how can we have best health for ourselves and the people that we serve? We'll be talking about it all here on season 2. And if you missed season 1, we got plenty of great content to share. Check us out. So, I'm Christine Ivory once again. I host this wonderful podcast, which is the Public Health Gems. I'm also a public health consultant. I am also a public health coach for those who are those early professional career folks or students in the field. And we love to convene community. So look out for our next in-person event where we will get those public health professionals together all in one room, one spot, one area to collaborate and to talk and to just have a great time and enjoy each other's company. So getting into our episode today, we are very excited to have a wonderful guest, a great friend of mine. We have Kelly McLaughlin. And here we'll just talk, and I'll give a short piece of her bio and some highlights off of her bio. But today's episode, we're getting into communicable disease as well as infection prevention. Really important topics. We thought about how this whole world of ours, this whole landscape, and even if we're thinking about on a local level, has changed so much with the COVID-19 pandemic. So it's so important to dive into that information. But then also, how can we protect our families? How can we protect our communities? What do we need to know as public health professionals in the field as it relates to these really intense, critical topics? So Kelly works for the New Jersey Department of Health and Communicable Disease Service, where she is a health education and outreach unit lead for infection control, healthcare, and environmental epidemiology program. Kelly has over 13 years. Let me say it again. She has over 13 years of experience in the field of public health. She specializes in prevention with programming, consultation, and project management. So Kelly also leads teams of health education specialists and infection control specialists, and she's able to train them effectively for those frontline healthcare professionals that need that proper protocol and prevention control as we think about reducing those healthcare associated infections. And on top of all this wonderful work that Kelly does right now, she is also a part-time adjunct professor at the College of New Jersey and not only one, there's two, Atlantic Cape Community College. So once again, we're so happy to have my friend, my colleague, so glad to have you here for our second season. Kelly, thank you for joining us. Thank you for being a part of the Public Health Gems podcast. And once again, we're excited to jump into this conversation with you and just get grounded around communicable disease and infection prevention. So before we really dig into some of the heavy things, and you could tell us some of those heavy things in your intro, but tell us about your background in public health. How did you get started? And then also, how does that education, how does your journey really just take your experience up a notch when we think about your role right now as a public health consultant in the infection and prevention side of public health?
Thank you, Christine. It's a pleasure to be on your podcast and kick off season 2. So excited. So I was thinking back, even after 13 years of experience, I think about back my time in college. Halfway into my college career, I didn't major in public health. The college I went to didn't have a public health program. I didn't know what public health even was. It wasn't until halfway through I was at an educational seminar, and I had learned about the field of public health at the time, and I thought to myself, even with my major in health and exercise science and knowing I wanted to do something health related, I didn't know at the time what that was. And then when I heard about public health, I was like, it's like the light bulb went on and I was like, that's what I'm going to do for the rest of my life. And that was it. And I took it and ran with it. Um, Unfortunately, at the time, I was still so invested in where I was in school. I didn't want to transfer. So I decided to finish the rest of my schooling out with my bachelor's in health and exercise science, and then went on to get my master's degree in public health. And during that journey of trying to pursue like what it is I wanted to do in public health, what I knew was I had an interest in education. And I had learned that public health education was something that was a discipline in the public health field in itself. And that, made it even easier for me to be like, that's what I'm going to be. I'm going to be a public health educator. I don't know what I'm going to educate on. And, I just was eager to then just get into the workforce once I kind of figured that out. I started 13 years ago at a nonprofit in Southern New Jersey that their focus was maternal and child health. I was so I was hired to be a health educator. I just had gotten my CHES credentialing, and I was hired to do specifically tobacco cessation and prevention work for specifically to pregnant women and parenting moms at the time. And so it was very narrow in population and scope. But what was kind of nice about doing that work was that I was able to, over time, expand upon my educational opportunities by talking to other populations about the dangers of tobacco use, like talking to students, talking to men. Like, it didn't have to just be women of childbearing age. And that was a nice like way to kind of get into public health and do some of that education. I also got to pivot at some point, probably halfway into my time at the nonprofit, that I was able to focus also on like childhood lead poisoning work and raising awareness and talking to families about the dangers of lead poisoning and how it affects their kids. Um, Everything, I look back on before came to the Department of Health, everything was education focused. Um, when I did tobacco work, I focused a little bit on smoke-free outdoor air policy. I often forget that that was a short stint in my tobacco career, was being funded with state money. You can't lobby, you can't go to a council person and say, I want you to pass this. Like, you're not allowed to, but you can advocate through education. There's everything I did was around education, and I was able to help municipalities, get these smoke-free outdoor air policies up and going through education. Um, I think about the coalitions that I led when I was doing lead poisoning prevention work. And all of that, again, was so geared towards education and raising awareness in hopes that all of these initiatives around education would hopefully get parents to get their kids tested for lead exposure, to get those exposures caught early, to be able to treat these kids. Um, all the things that I think about, it was always geared towards education, I think. And answering the other part of your question was, how did that prepare me for my role as a public health education consultant for the state of New Jersey? And I'll be honest with you, it was quite a change, because I was so community centered for 10 years, and it was a great experience. But then I'm now providing education. My team is providing education, but we're not in the community anymore. We're now in healthcare. This is now, we're talking about the healthcare community, and we're focusing not on the public. We're talking healthcare workers. And so we're talking about nurses, physicians, lab techs, EVS, you're the people who are, cleaning and turning patient rooms over. And so, but the one thing that, even though that was a challenge for me to pivot from community to healthcare, and it still is after being there 3 years at times, education is education. And I think as a health educator, with my experience, because I have a lot of experience in all the stages of health education programming, whether it's, from development to implementation to evaluation to assessment to all of it, all this experience, regardless it's community or healthcare, I think that did prepare me well for the position that I'm in now.
Absolutely. Wow. Kelly, thank you for sharing that and giving us that deep dive into your experience. And that was just like everybody, that's just a tip of the iceberg for Kelly. Like, she is a powerhouse. I did not mention this, but I'll mention this now. That organization that she was talking about, that's where I met Kelly. So we were working under the same roof at the same organization. And I just, wanted to talk to her right away. Like, how did you do? What did you do? How did you get here? Like, I was that person. I had my, I think a little what do I call them? Like a little coffee date with you that was like virtual. I'm like, Kelly, tell me the things, tell me all that you know. Um, but Kelly, there's one thing that you just mentioned, and I'm going off of my questions for a second, but you talked about the CHES and the MCHES and that process. And I think that with public health, there's people that are always asking, like, what certification and what type of this should I have, and how can I diversify my resume, and just all these different questions. And I know that I get them. I'm sure you get them a lot too. But can you just tell us a little bit of what CHES is? We had a panel like last year with Sisters of Public Health, really great conversation that came out of that. But just like a quick, like, high level view of like, what is your CHES or your MCHES? I have my CHES too, by the way. And just want to hear from Kelly from her perspective though. What's your CHES, and how did it help to inform your work as well?
Sure. So back when I was doing my internship to complete my bachelor's degree, it was at a county level health department in South Jersey. And my preceptor at the time, who is CHES certified still, had said to me, Kelly, if you're really serious about a career in health education, I highly advise that you sit for the CHES exam. I didn't even know what it was. And she explained it to me. She gave me the website. She told me how to find out if you're eligible to sit for the exam. She gave me all the things to prepare me to take it. And I went through the pre-screening criteria because I didn't have a bachelor's in public health or community health. So I had to find out if a degree in health and exercise science would make the cut. It did. And I sat for the exam, and I was able to get my CHES certification, and that took a lot of studying material that I did not know because I didn't go for a degree in public health. So I was kind of at a disadvantage education wise. So some of that had to be self-taught. But I did invest in a prep course as well to take the CHES exam. And if you're serious about a career in health education or wanting to be a health educator, I highly recommend sitting for the exam. The credential is really the gold standard in health education. And after you've been CHES certified for so long, I think it's like 5 years, or you have your master's degree in public health or health education or something within that scope, you would then be eligible to sit for the MCHES exam, which I did. I was CHES certified for 5 years around the time I got my master's degree. So it happened to just all kind of fall into place that I just was like, I've made it this far in my career. Why am I gonna, let's just finish it off. So
Well, look, Kelly, I'm on that next step. I think I'm on the last year of my CHES, and it's time for that MCHES. So I think I'll be studying again.
it's worth it. It really is worth just doing it. If you make it that far, yeah.
Thank you for that inspiration and motivation, and for anyone that's listening in. CHES, first of all, CHES should probably give us some coins, because we've been talking up CHES a lot in the last couple of months. But I agree. I do think it's worth it. I do think it is good for diversifying your resume, but also like to give you that experience. Like Kelly, you mentioned, like it was like in the kind of like almost a prefix, like at the beginning of your experience in public health. For me, I didn't know about the certification at all, and I graduated with my MPH, and no one talked about it at school. And then I came out and someone's like, oh, you want to get your CHES? I'm like, oh, I think I will. Because health education, I was a health educator at the time as well. So it just helped to really, I think, enhance my learning, and also at that time to give my brain a refresher. So I think for anyone, like you mentioned, that is very serious about health education and really just developing their skills, it's a great certification and program to be involved in. So Kelly, thank you for that. Thank you for going down the road with me on that one. So our next question, you gave us some of this information within your introduction, but we know that when we talk about communicable disease and infection, there are so many different external factors and different things that are just around that surround it, that can certainly impact health. And one of those impacts can be environmental health. So we know that it ties to disease, it can tie into infection prevention. And so can you share more about that background, with environmental, with home health, with tobacco? I even saw, we didn't even talk about this, I don't think, in our conversations, but I think back in the day you did some work around work safety. Like, just tell us about environmental health and how that plays into that whole disease and infection prevention role as well.
Sure. So it definitely does. Our environment certainly has significant influences on our health. And you and your listeners have probably heard the statement that your zip code often influences your health more than your genetic code. And that also, speaks for life expectancy. And when we think of chronic disease, we often think of people who don't exercise or poor diet, or it could be tobacco use, it could be. So these do contribute to chronic disease. I think what's also important to note is that the environment does have an influence on those factors. So I like to think about like poor diet and its contribution to chronic disease. Yes, processed foods do contribute to chronic disease, and it's the environment and how we get those ingredients to make that processed food that are also harming our environment and also harming, our health. So how we're getting those ingredients to get those foods made for us to eat, it's hurting the environment, but it's also hurting us. I think about lack of physical activity. That's not necessarily maybe a laziness factor. It could certainly be that the built environment is simply just not designed for the people who are living it, and that can contribute to poor health outcomes. Um, Smoking, I mean, that is a health behavior that is to quit, but exposure to environmental tobacco smoke in public areas and outdoor areas, we know that can affect vulnerable populations like kids and people with pre-existing conditions when they're exposed to that. So but then even more so when we're talking about environmental health, it's so much more than that, because there are people not just in New Jersey, but around the country and around the world who are exposed to high levels of pollution. And we're talking about air pollution, water pollution, and the unfortunate thing is that these pollutants, I mean, they have the ability to impact people even before they're born. I know your experience, you're very heavily involved in maternal and child health, and there's a lot of environmental toxins and agents that pregnant people are exposed to that they're taking in, and so are their babies, and it's already setting their babies up for possibly poor health outcomes before they even, come earthside. So depending on where people live, whether they're living near Superfund sites or major highways where there's high concentrations of air pollution from car exhaust and diesel exhaust, or smokestacks from industrial sites, or like illegal dumping. Like there's a lot of things that can contribute to the poor quality of the air that we breathe, the water that we drink. And water, we have to water plants or crops and things like that. It gets into our produce, and it gets into, when if we eat meat, a lot of that stuff is also treated with like antibiotics and other types of agents, and that can lead to possible antibiotic resistance, in people, when we're talking about bacteria that are now resistant against those antibiotics because it's being pumped into the livestock that we're feeding. So it all affects us, all these things, and we don't often think about it. We don't think about those things until it's really like in our faces. Um, but and going back to like my experience in environmental health, so when I worked at SNJPC, my focus was for a while was childhood lead poisoning prevention. And in that time, I had the opportunity to educate not just on lead poisoning, but also how to talk to families about how to live a greener life that doesn't necessarily break the bank. So we had these healthy homes toolkits, and they were these like green grocery bags. And they had all the things like a family would need to make their own green cleaners at home. You had white vinegar, you had baking soda, you had a measuring cup, and it's amazing what you can do with those couple of things and some just dish soap. It doesn't matter what brand you buy, and you can make all these green cleaners that you can clean your home from top to bottom, and they're not laden with chemicals. They don't pose a health risk. They're completely safe. They're child safe. They're pet safe. Um, I really loved talking about green living and how it doesn't have to be expensive. It is affordable, when you know just what it is that what you need. It was hard to talk to people about like changing their ways of wanting to be like, well, I like my bleach, and my bleach, I love the smell of bleach. It smells clean. And it's like, yes, but too much is a bad thing. And if you mix it with something else, that can be deadly. It's hard to, teach people who are, have their habits already in place, but they were blown away by the things that they could do with just a few ingredients. Um, but yeah, I've always had a bit of an interest in environmental health even before I knew what environmental health even was. It's been a personal interest of mine. And going back to the workplace. So now, because we go into healthcare settings and provide infection control and prevention education, a lot of that does relate to the workplace, because this is not just a place where people are receiving care, but this is still a workplace, and for healthcare workers to be able to do the several different duties that they have. So, just to give you an example of some of the workplace like safety topics that my team and I talk about that also are in alignment with infection control, is we talk about environmental cleaning and disinfection of healthcare facilities. Different facilities have different policies and procedures and regulations when it comes to cleaning and disinfection and sterilization of medical equipment, certain surfaces, patient preparation areas, patient rooms. There's a lot of different cleaning agents that need to be used for certain equipment, certain devices. And so it's our job to make sure that they are following those proper protocols and procedures in order to minimize risk of infection spread in healthcare. And other things we talk about is making sure that healthcare facilities have proper ventilation, because air quality is just as important inside than it is outside. Because we can still spread infectious diseases in healthcare when there is poor ventilation practices. Even making sure that you're wearing, as a healthcare provider, the right PPE. Patients are in healthcare for different reasons. Maybe someone's having surgery, maybe someone's sick with something. Everyone's situation, if in a hospital, is different. They're there for a different reason. And so depending on why they're there, the healthcare worker may have to wear a different type of PPE when engaging with that patient. So we want to make sure that they're wearing the right type based on why that patient's there, and that they are taking it off at the right place and at the right time as a means to minimize infection spread when they go to the next patient room that they're going to visit. So that's kind of just a couple of things that we talk about in healthcare to minimize environmental risks and infection transmission spread.
Kelly, I'm smiling because you are just dropping gems left and right. I need my notepad out in front of me because we were actually, you just mentioned I am in the maternal health space, and we're to be in the space that if you have a doula, that means that they're advocating for these different types of options and alternate ways that you could kind of either relax your mind or give birth, all these different things in your space. And we're talking about like those big huge like exercise balls, and like how women are birthing, people will use those like during birthing and everything like that, or during that time. But then also things that we don't think about, like how are those items clean, how where are those items kept, and like, all these different things that I would never think of and jog my mind about. So I appreciate you going into like the depth and the breadth of like things that we need to really know and hone in on. And even like PPE, like it just obviously something that we should all know, but like how and the when and like all those things are so very important. So thank you for sharing and really just dropping those gems around that. So for one of our next questions, last season on season 1 of the Public Health Gems podcast, we talked to Jenny Robeson. She told us about her experiences during the COVID-19 pandemic. She's working at the Philadelphia Department of Public Health. And there during the pandemic, they had a particular shelter where individuals could come and they could just be safe. And if they needed to be able to just be in environments where they could, be together as families in a safe environment. So she gave us some of those educational messages that she gave to like those frontline workers. And I'm kind of asking like the same thing, like with your work now, like what are some of those educational, like those key educational messages? You just gave us some too with the PPE and like that really good information, but like those initiatives that you work upon, how do you develop those for your team when it comes to disease prevention? And also, what type of advice would you provide to public health folks like me or folks that are on the front line working in the field? So I think you dropped some of those gems, but feel free to give us a little bit more on some of those aspects there.
Sure. So, yeah, I'm very, I'm very proud of my team that we've done a lot in 3 years. And Project First Line is an educational initiative. It's a national educational initiative that we have in New Jersey. We've made it our own, and adapted it to the needs of the healthcare workforce here. And one of the things I'm most proud of is my team had this idea that yes, infection control in healthcare is incredibly important, and we should always be providing this education to healthcare workers because it never hurts to hear it over and over again. I think we all need a refresh in the basics from time to time. Even if we think, oh, this is so elementary, this is so simple, it never hurts to hear it over again. We all could use a refresh. But they had this idea of why don't we provide this education to the future healthcare workforce? There are students coming out of college or medical school or nursing school, public health school, whatever, every semester, every year, and they're going to wind up in healthcare or in the public health field. And why don't we help in providing some of that education while they're still in the classroom? That way, when they go into work, we certainly hope that they'll receive some more in-depth training and education, but why don't we kind of plant that seed a little earlier? And so we developed this college tour initiative in New Jersey where we've partnered with academic partners throughout the state, community colleges, state colleges, well over a dozen schools in the state of New Jersey since we've been doing this, and have been able to provide this infection control education to students. As of right now, my team is we're doing less schools this spring semester, but we're partnering with Monmouth University right now this month to deliver this education to the public health program that's there. So that's really exciting that we're still getting into schools, and schools, constantly are asking to have us come back, which is great. Another thing that, I'm particularly proud of that my team had also done in partnership with a few other jurisdictions throughout the country that are also putting on Project First Line, because we love education, even though we're talking about serious topics, we can also have fun with it. So we developed a escape room around infection control. So we did this with the state of New York, Utah, and Wyoming. And we developed this, over a year ago at this point. And it's a 4-station escape room that you can set up in just like at a conference room table. And it has all these like puzzles and riddles and elements like you would have in an escape room that you would go to like just for fun, but it has an infection control theme to it. And just like an escape room, you have to finish it in a certain amount of time. We don't lock people in any rooms. But we use lock boxes and little like things to kind of give it that like escape room feel. It's a superhero theme. It's amazing because this is it's been a tool that has changed hearts and minds. Because, some people, you come into a training and they're like, oh, an escape room, really? Like you kind of feel like that the energy's not there. And I said, just you wait, guys, like just you wait. And then less than half an hour later, because most of them do finish it under half an hour, they're like, oh my God, that was amazing. And like, so you just see the energy, and then, it gets competitive because there's teams, people are trying to beat the time. Um, but it's a fun way to learn about the topic too. We've offered this in New Jersey many times with students and healthcare workers. We just did an escape room at a surgical care center last week, which was really cool. And it's been a hit throughout the country. A lot of our Project First Line jurisdictions throughout the nation have been actively wanting the manual on how to set it up and do it themselves. So that's been probably some of my proudest things we've done. And then going into talking about like what would I, in terms of advice for the workforce, I'm not a clinician. I'm not, I don't work in healthcare. I never have. I've always been either in nonprofit or in government. So I try to be sensitive of the fact that in healthcare, especially in certain areas of healthcare, like long-term care, for example, staffing shortages continue to be a chronic problem. I recognize that. And it's been said, in a lot of assessments that we've done that, that's a barrier to getting this education to staff, is that they're short-staffed. And because they're short-staffed, they just don't have the time. And I'm not invalidating that. But at the same time, we need to make time. We need to, because if we don't make the time, it's doing a disservice to our patients and the people that we're serving. Because if they don't get this education and they don't get this training, the infection control, or the infection rates are just going to continue to perpetuate. They're not going to go down. They're either going to go up or they're going to stay the same. So we have to figure out a way to make the time, invest in our workforce, give them the training that they need in order to be able to do their jobs well, to be able to take care of their patients, reduce the transmission of these types of infections, to be able to get them out of the hospital sooner, and also not have them come back. We don't want them to come back after they leave. And a lot of the time, healthcare associated infections, maybe they don't necessarily appear until someone comes home. And then they're back in the hospital. And maybe it's because of maybe a bacterial infection, could be sepsis. Like you just don't know. So, that's my advice. We really do need to make the time and stop saying time is an excuse.
Kelly, we're gonna put that on a shirt, okay? Make the time. Make the time. I love that. And I'm definitely gonna put that in quotes somewhere for sure. Thanks for saying that importance, because yes, bandwidth is short. Yes, there's staff turnover. Yes, things are tight in healthcare, but it's so important too, like you mentioned, in that emphasis around making the time. And you have me with the escape rooms. I don't know how, but I might want to transfer that to some of the work that I'm doing. So we are learning a lot from you today, Kelly, and just about the creativeness and the innovation too. It's really great to hear about it, because it doesn't have to be our dab and drab trainings. We could have an escape room if we want to. You're just livening up our possibilities, I think, for the public health listeners out there. So you mentioned this in your last answer, as you were just sharing out with us about just the upstream impact of what you all are doing in the colleges and the universities, which I love. I love to talk about upstream approaches. So transitioning just a little bit, as we think about colleges and universities, we are excited to hear more about your role as an adjunct professor. So feel free to share more about your inspiration of how you even got into the field of teaching. We know that education has been ingrained in you, right? But we would love to hear more about that background in the teaching realm. But then also, like, what insight would you give and share with public health professionals that are interested in either pivoting in the field and like starting as an instructor for a college, or like we can talk about it all day because I think that I get a lot of those questions too, like how do I get into the field? So I would love to hear your perspective of like how you got started and like what advice you might want to share with some folks out there.
Sure. So as I mentioned, I love health education. And I think back on my time as a health educator, and I think some of my most favorite times in my career have been educating. But then, like anyone in the professional world, you want to move up, you want to advance. And what happens is when you get into management and leadership, you sometimes have to shed some of those responsibilities that you once had. And um, because now you have a staff or a team that does those things now for you. And um, and that was hard because now I've been at the state 3 years and I don't do education at the rate that I once did. And I tell my team all the time, I'm like, you guys get to go out and have the fun. I have fun, but it's always a pleasure when they say, Kelly, we need an extra set of hands. Can you come? And I'm like, oh yeah, I'll be there. I'll be there. Like, I'm all giddy but you know, um, I realized like I didn't want my skills, my public speaking skills, and just all these other skills to kind of just start to slip away because I feel like that does happen when you get into management. And so I thought, how can I keep this going? And I did entertain the idea of teaching. It was something I had always been interested in. And at the state, I learned that there's a lot of people who do teach part-time. And I saw that, they seem to manage it pretty well working full-time at the state. So I thought, maybe I'll give it a try. I didn't know if I was going to like it because health education and teaching are kind of the same, but they're also different. I can teach about a subject matter, but I don't have classroom management experience, and it's different than managing a team of people that you that are your employees, so that they're students, not staff. So that was a little bit of a challenge, but I also love workforce development. That's always been a personal interest of mine, and so I what I ended up doing was I connected with some of my college professors at Rowan, and they encouraged me to apply. They taught me like where to go to apply. And usually when you apply for a teaching position, there's usually like a candidate pool. You just throw your resume and your cover letter in there. And if there's an opening, you're contacted if they think that, you would make a good fit for the course that needs an instructor for. Um, my advice is maybe start at, look at your community colleges, especially if you're starting out and you're not really sure, is this for you? I'm honestly glad my first teaching opportunity was at a community college, because again, I wasn't sure if I was going to like it. And I did, and I'm at my fourth semester there. It's been a good experience. Um, the other thing I would just say is, don't get discouraged with like when you apply. And the reason why I say that is because right now, and I can speak at least in New Jersey for the couple of schools that I teach at, enrollment is down. Enrollment at colleges and community college is way down. And when enrollment's down, what I've learned is that that's fewer course offerings. So they may not necessarily need as many instructors because there's not so many students that are registered for these particular courses. So right now, enrollment's down. It's been like that since COVID. And even though things with COVID have improved significantly, the enrollment numbers just aren't back to where they are for several reasons. And so I would say don't get discouraged, apply anyway, network, talk to your professors, let them know, like, hey, are there any opportunities? Can you let me know if there's any opportunities? Um, and just, keep applying. I think you can always, I think like once a year, they usually kind of, they like update the candidate pool and things like that. So if you don't hear after a year, throw your hat in the ring again. And you never know what's going to happen. TCNJ, I applied. I couldn't even tell you the last when I applied. I don't even remember, but I got an email out of the blue back in the fall. So there was an opening. I'm covering for someone who's on maternity leave right now. So, I don't know with TCNJ if this is a one and done. Like after the spring, they're gonna be like, okay, Kelly, thank you for your service, and that's it. Or I don't know if there'll be an invitation next fall, but so again, I think if you want to teach it, do it. It's a lot of fun. But be patient. That's all I say.
That's a good one. And thank you for just sharing that motivation for jumping in the pool. Because a lot of folks I talk to, they're like, I want to, but I haven't done it before. Or I want to, but I'm just a little bit like on the fence. And I think, like you mentioned, it's good to like give it a try to see like how you feel about it. And like you mentioned, it also builds like those professional development skills in your public speaking as well. I know for me, my first class teaching was a public health 101 course. So starting with the basics, right? And I had a good time doing it. And I'm like, okay, after this one class, I love it. I want to do it again. So I'm teaching now. I'm teaching a child's health or a children's health class. So I get to weave in my maternal health with child health and just have a lot of good times with the students. And in my experience with this particular course, not only am I teaching it, but I had to develop it. So it was really interesting being a part of that experience of like curriculum development, which I've done in the past, but just also weaving that in with teaching and making sure that it makes sense and all the things. So it definitely helps to once again diversify the resume and help to build you up with that professional development. So we love it. So thank you, Kelly, for sharing. All right, one more question for you before we wrap up today. So Kelly, like I mentioned at the top of this discussion, she is a powerhouse. She does that real wonderful work at the Department of Health and then also teaching, but she is a part of various organizations within the public health and health field. So Kelly, could you share more about the organizations that you're involved in? Are there any upcoming events or anything that we should look out about? And one thing that you said during your last question is about like the importance of network. I always say that your network, your net worth is your network. Your network is your net worth. So just kind of share a little bit more about like some of those roles. You've been in leadership, just doing some wonderful things and trailblazing. What should people know about these public health organizations?
Yeah, so I am a very active member of Sisters in Public Health and the New Jersey chapter of the Society for Public Health Education. So Sisters in Public Health, I've now in my second year as the Philadelphia chapter co-chair. And it's been a really great experience. I have a great co-chair, and what we have been doing during our time as chairs is providing opportunities or networking opportunities in person and virtual to women in public health, whether they're studying or working or both, in the Philadelphia metropolitan area. And so we've had social events. We've done some service events in the Philly area. We just actually had a great webinar. It was our first virtual event we've done, which was really cool. We did that last month, and we had some subject matter experts come on. We did a panel in partnership with the Washington, D.C. chapter, and we talked about, because it was the beginning of January, like good goal setting advice and tips, and we recruited subject matter experts who have been in the public health field for a long time. They're more seasoned, have, much more experience. So we wanted to kind of get their take on, how have they been able to set themselves up for success throughout their careers. And it was a really great open conversation. So we're looking forward to planning our next meetup in the spring. So we're actively planning some ideas out for that. Sisters in Public Health is a great organization. It's a national organization. It is a nonprofit, and there's chapters cropping up throughout the country. There's a handful of chapters that just launched just last month. So I highly recommend you check out their website to find out how you can get involved and be a member. Lots of great opportunities always happening with that organization. And then New Jersey Society of Public Health Education, so NJ Sophie. Again, that's a state chapter of Sophie, the national chapter. So as a health educator by background, I really found a lot of value in being a member of NJ Sophie because I get to connect with a lot of New Jersey-based public health educators. A lot of them are with local health departments, some of them are with the state health department, some of them are in nonprofits. But it's been a really great way to connect with people in the same geographical area. I am the membership chair for NJ Sophie. I've just started my second year as membership chair. But I've had a lot of positive experiences, and my team and we actually presented at.
I think that it's so important to talk about all these different networks out here, because I think sometimes we're out here and we're like, okay, there's a social work places for the folks, which is great. There's a places for the physicians. There's a place for, you know, all these different professionals in the field, but where do the public health people go? So you just listed some great ones. Big ups to Sisters in Public Health. I had the opportunity to be there in leadership for a few years, and there's APHA, the American Public Health Association. There's so many great organizations where folks can be involved and get involved. And you might say, okay, well, I don't have time to like really get involved and get down and dirty with a lot of like the inner workings, but it's great to like get out to some of these networking events or the mixers or the online events just to meet other professionals and like folks in the field. So we love it. And speaking of that, like I mentioned, look out for what the Public Health John has coming up next. We do have our in-person convenings. You'll hear about some of our mixers. We had a really great one in the fall. So we're looking forward to having our next event and getting everybody together again, just to collect, convene, take a load off, relax, but then also just to learn from each other. It's so important to be in these spaces. So with that, Kelly, thank you so much for just taking time out of your busy schedule to drop gems on us today. The information that you provided was so valuable, the insight that you just gave to our Public Health John community. So for those folks out there that are looking to connect, they want to say, hey, Kelly, what's going on? We want to learn from you. We want to talk to you a little bit more. Where can the folks find you? Where are you at?
I can be found on LinkedIn. So I can actually send you the link to my profile. So I don't know if you have show notes or something, but we can drop it in there for people to find.
That's exactly where it will be, folks. We will put it in the show notes. Yeah, we'll put in the show notes. And Kelly, I mean, she has so much, you know, great information to share with us. She shared with us today. So just feel free to tap and see where she's at, and to try to catch up with her as I did today. So thank you to our great subject expert matter today. Kelly came through for us and dropped gems for our second season. Look out for a wonderful, great season 2 from us. We'll be talking to folks all throughout the field. Kelly, we want to thank you again so much for being here, and we'll see you next time on the episode of the Public Health Gems podcast. Until next time, bye everybody.